afternoon. Priorities for Progress, Assets and Aspirations in Southern Indiana is a lengthy study that brings together publicly available quantitative data, survey findings, and community conversations about aspirations, challenges, and big ideas. I cannot possibly cover all of it this morning or this afternoon, so I am going to try to give you a few ideas for using the document, highlight some notable findings from the profile data, and very briefly highlight some key findings from the survey. Then I'm going to highlight what you all told us about where you think the foundation should direct its resources and give you some points of comparison between your responses and those of nonprofit leaders, as well as your quality of place priorities compared to the full sample. The focus on quality of place is because this is the area the foundation has chosen to focus on for the next few years. So that's why we took a little more time with the survey on that, and I'm going to highlight those things today. As the focus area for the foundation, they are seeking to make larger, hopefully more impactful grants to move the needle on key quality of place priorities. Once I've presented the data on the quality of place priorities, I will then move on to our recommendations more broadly from the study and provide some explanation and get your reactions and any interpretations or thoughts that you have on the study. So a few notes on sort of the design and function of the study. I encourage folks to pay attention to assets. We've spent a fair bit of time on assets in the report. We have long used the language of needs, but research indicates that focusing on assets can be a productive and empowering approach to community development. The challenge is to balance a focus on assets with the need to prioritize responses to the places where we struggle the most as a community. In an effort to direct your attention to assets, when we present respondents' ratings of community resources in the report, we use the color green across all sections of the report to denote areas where survey respondents indicate that the community does well. So you'll notice some charts where we either present in red bars or we present in green bars. Red bars are areas where we maybe have more challenge, and green bars are those areas where we have more assets. In addition, Appendix B provides the asset maps generated through aggregated individual responses to a community asset mapping tool provided by the Center for Rural Engagement at IU Bloomington. We conducted those asset mapping exercises at every community forum, and we did 8 community forums. Assets tell you about the resources on which the community can build to address challenges. Those assets in that appendix, in Appendix B, are things that people who live here think are assets. Appendix C in the full report provides a listing of ideas generated when we ask people to imagine a world where money and politics were not obstacles. So I encourage folks, if you look at the full report, which you may either have a paper copy or you can go online to the Community Foundation of Southern Indiana's website where they have the full report available for download. But I encourage you to take a look at what people told us they would like to see for their communities. From indoor and outdoor gathering spaces in Greenville to small business development spurred by a Rails to Trails project in Gordon, our residents imagine a vibrant economy marked by community and civic engagement. These are our aspirations. The Community Foundation, donors like yourselves, other funders, businesses, and local governments make choices about where to direct resources. Some investments are about increasing quality of life and place for everyone. But sometimes we want to specifically target the needs of those in our community who may be struggling. So in some places, I've made a point of highlighting income differences in priorities to help people recognize that people that occupy different social locations in our community perceive needs and priorities differently. Last, I encourage you to recognize the importance of mismatches between perceptions and objective data. These mismatches offer important opportunities for learning and growth. Some of those mismatches are mismatches in our data, but some of them may be that you read the report and you see some data points and you're like, I don't think that was the case. That's a useful place to stop and really take a look at what the data are telling us. Overall, items identified as priorities by the largest share of respondents focus on basic access to education, health and wellness, housing, infrastructure, and living wages. That's because these are the foundations for everything else. These are key parts of our system that work together and affect one another. Each exists in its own reinforcing feedback loop. Lower educational attainment tends to produce lower educational attainment in the next generation, for example. But they also feed each other. Higher levels of education improve health behaviors and earnings, and higher earnings make it easier to access healthcare, healthy food, and physical recreation. Stable housing supports stable employment, which can lead to higher earnings, which then impact health and make it easier for children to focus in school. Childhood stability and health produce stronger educational outcomes that generate higher incomes. When we shift any of these in a positive direction, it can and does cause positive shifts in at least some of the others. When any of them are going the wrong direction, it can cause problems in the others. When low-income workers do not have access to quality, affordable childcare, they may not be able to maintain stable employment, which reduces earnings and negatively impacts health. Reliable transportation is an equally important leverage point that shapes access to education, healthcare, and stable employment. Health. Access to physical and mental health care, as well as substance abuse treatment, were common themes in community sessions and came out as top priorities on surveys. Our 2015 work did not provide opportunity for these issues to come out as strongly, but they were present in open-ended responses. This time, we have a fuller picture of the level of concern around substance abuse and mental health in particular. We know these issues cut across class lines, and we know that a chunk of our substance abuse issues are the direct result of self-medicating for untreated mental health issues, and that misuse and abuse of substances comprise and exacerbate poor health behaviors contributing to poor physical health. Consistent with our 2015 findings, health behaviors remain a barrier to healthy outcomes in both Clark and Floyd counties. Obesity rates are higher than the state rate and much higher than the healthy and wealthy Hamilton County. This issue is partly driven by high rates of physical inactivity. And while smoking rates have declined some, they remain high at 22%. These patterns lead to lower life expectancy than the state, 2 times as many years lost to premature death as in the state's healthiest county, more poor physical health days and more poor mental health days, which lowers economic productivity, lowers educational performance, and decreases quality of life. Substance abuse occupies 2 of the top 5 social issues of greatest concern in the survey findings. For Floyd County, a high percentage of driving deaths involve alcohol, and the overdose death rate is significantly higher than Clark County and nearly twice the state rate. Clark County seems to have a greater willingness to talk openly about their substance use issues than does Floyd County, and it's killing us. Both counties are home to strong and active coalition efforts around public education and advocacy to prevent and respond to substance abuse, but engagement of community leaders varies across the 2 counties. A top priority and area of concern was access to physical and mental health care. As you can see, we have particularly short supplies of primary care physicians and dentists. Some community members note that these figures for number of residents per provider understate the mental health provider shortage because so many of our surrounding rural communities are also counting on providers located in Clark and Floyd counties. One might counter that our own access to Louisville may offset that, but anecdotally, we heard story after story of residents struggling to access care, sitting on waiting lists for months, or simply not finding the care they or their children need in an accessible location. Local providers indicate that in addition to supply challenges, recent reductions in an already insufficient transportation system have reduced consistent engagement with mental health services and substance abuse treatment. Education. Here I want to pay attention to what the objective data suggests is an area of opportunity and some differences between lower income and higher income responses. We combined Clark and Floyd counties for this chart to make it easier to read, and I think you can read that from there. Clark and Floyd counties are behind state and national figures for graduate and professional degrees and bachelor's degrees. A larger share of our population has associate's degrees or some college, no degree. The latter is the group that the Education Matters Southern Indiana effort intended to address. These 2 categories are likely where we find our people with trade certificates, many of which are earned through programs at Ivy Tech and Purdue Polytechnic. We have a smaller percentage than the state with high school as their highest level of attainment, though still higher than the national figure. And that's good considering we're pretty close to national and state rates for four-year high school completion. But being, having more at that level than the national still leaves room for us to improve on higher levels of attainment. The less than ninth grade is generally a measure tied to the portion of the population between 80 and 100 years old in the community. Our life expectancy explains our lower rate there. So because people don't live as long, we have a smaller percentage of people with that lower level of education. So the key here is that we are underperforming in four-year degrees and higher, so graduate and professional degrees, and outperforming in two-year degrees and some college, and high school is highest level if you look at the national figures. To the extent that this reflects strong uptake in the trades, this may be good. Based on completion rates at IUS and Ivy Tech, however, I believe a significant portion of this figure represents college dropouts and stopouts. Stopouts are people who stop for a while but then come back. At IUS, we know that health and mental health concerns are among the most common reasons cited for stopping out, while financial challenges and the need to work are also drivers. These next two slides explain why this concerns me. This chart shows median earnings locally in the state and nationally for each level of educational attainment. In the source table, the Census Bureau combines some college and associate's degrees, so I can't split those out. Notice the significant jump in median income from that level, some college or associate's degree, to the bachelor's level. The median in our area for that level of education, meaning half the people at that level of education earn more than that figure and half earn less than that figure, is about $37,000, compared to $47,000 to $53,000 for those with a bachelor's degree. The table here on your left shows you that generally we're doing quite well in graduating high school kids within 4 years. Dropout data are not a very sound science, but these data suggest we're doing pretty well on the four-year high school completion front. This does not mean that we do not have dropout issues, but it suggests we are doing well on high school completion and we have a larger share of people with associate's degrees and some college, the category that likely captures trade certificates, but we are lagging in college and graduate level attainment. And yet, when we provided respondents with a list of possible priorities for education, which you see in the chart on the right, four-year degree completion comes in number 10 out of 10 options, excluding don't know. College scholarships is in the number 2 spot, which reflects recognition that cost is a barrier. And it is vitally important to note that half of respondents see early care and education for birth to 5 and after-school programs as top priorities, both of which are essential supports for families and vital for single parents. But as a region, there seems to be a failure to understand that lower educational attainment will place a cap on progress. I am admittedly a biased observer as someone who works at a four-year institution of higher education and who holds a bachelor's, a master's, and a PhD. But I am also published making a strong case against the College for All movement that led us away from supporting youth pursuing the trades and forced lots of young people with no interest in college into our classrooms. I don't think that was a good move, but I think it is equally problematic to embrace trade certificates and high school level career pathways as a silver bullet. As a region, if we want a healthy economy capable of innovation and adaptation, we need high quality labor across diverse fields that require varied levels of education and training. That must include college, graduate, and professional educated workers. This is a place where I also want to note discrepancies not just based on income, but also differences between your responses and those of business owners and, oh, actually, I'm not gonna go into that. I'm sorry. Economy, little editing error. And this brings us to our economy. I'd like us to recognize the clear opportunities presented by our local data. With this in mind, I'm going to highlight data points that suggest areas of unrealized economic potential in our local community. Priorities for Progress makes note of the income distributions of the two counties. Clark County's distribution is a normal bell curve distribution. Floyd County, however, has a somewhat larger share of its population at the ends than does Clark. Plainly, Floyd County is a more affluent community with a larger share of the population in the top 3 income groups. But Floyd also has a slightly higher share in the bottom 2 income categories. You may say those differences at the bottom are really small. They do appear that way. But we also looked at the income ratio. To calculate the income ratio, researchers place all household incomes for the county in order from highest to lowest, and then divide the group into 5 equal quintiles, each representing 20% of the population. The household income at the 80th percentile is then divided by the household income at the 20th percentile. The result is a measure of inequality. Counties in the US with the highest ratings for health and well-being have an income ratio of 3.7. This means that in these thriving communities, the highest income households earn 3.7 times what the lowest income households earn. The United States has an income ratio of 4.9. We are among countries targeted as having problematic levels of income inequality. Indiana's is 4.4. Floyd County's is a relatively high 4.5, and Clark County's is 3.8. This finding suggests the need to lift the floor, which can happen in many ways tied to all different sections of this report. Good jobs with living wages are created and maintained when communities focus on foundations of education, infrastructure, health, including mental health and substance abuse, and safe, affordable housing. When we look at median earnings and median earnings by sex, we see a gender wage gap. The gap in Floyd County is larger than at the state or national level, but Clark County's is a bit smaller. This is likely tied to some of those very high earnings in Floyd County, which are likely men. Still, there is an enormous literature in my field on the drivers of the gender wage gap. There are a number of different forces at work. Among them is bias in wage setting. In addition, as a society, we tend to place greater market value on masculinized work and less value on feminized work, even when the same level of training is required and the occupations provide comparable value to society. When an occupation shifts from predominantly one gender to be more heavily weighted to the other, the wages tend to also shift in ways that mean women who may have worked to enter a male field find the returns for their effort decline as more women move into the field. And when men move into a field, wages tend to increase. Finally, women are less likely to negotiate, in part because they are socialized not to. Regardless of what drives the issue, it has real consequences. Namely, because single-parent households are disproportionately headed by women, the gender wage gap contributes to child poverty. Child poverty is a risk factor for various issues of concern in the region. This is partly because it limits opportunity, but also because financial hardship in a household can cause chronic stress and toxic stress, and toxic stress, as it's called, has physical impacts on the body that shape future health, mental health, education, and employment outcomes, as well as risk for substance abuse. So the gender wage gap is not simply about making sure women are appropriately remunerated for their labor. We benefit at the community level when we close this gap. On page 29 of the report, we present both Clark and Floyd County data on the overrepresentation of Black, Indigenous, and people of color or BIPOC communities among our region's poor. The issue, again, is more pronounced in Floyd County than in Clark, but it is a troublesome pattern reflecting historically rooted systematic inequalities in both communities. Addressing racial inequities has the potential to reduce poverty and all of its associated impacts, raise median income levels, and improve quality of life. Finally, the employment ratio tells us what % of each age group is employed. I like this figure better than the politically derived unemployment numbers we regularly track, and so that's why I focus on it here. This number does not account for those who are unemployed by choice, so stay-at-home moms, early retirees, people caring for a family member, or the like. But those people are everywhere, so they are still useful for comparison purposes. Generally, Floyd County has higher employment ratios than Clark County, suggesting unrealized potential in Clark County. There may be some employed as well, but we can certainly tell there is in Clark. The one category where Floyd County's ratio is lower is age 30 to 34. I do not know for sure what is driving this, but I suspect it is primarily women, or parents more broadly, of childbearing age taking the time out of the paid labor force for those first few years until their children enter school. This is a common pattern, and there are two reasons the pattern might be more pronounced in Floyd than in Clark County. Remember those income distributions and Floyd County's higher percentages at both ends of the income distribution? More families in Floyd than in Clark have high enough incomes to be able to support one parent staying home for those first few years. But also, the short supply of quality, affordable childcare may lead those at the lower end of the distribution to forego work. At $2,000 per month for quality infant care, a family with 1 or 2 kids under the age of 5 may decide that it simply does not pay to work. For low to moderate income workers, this is a straight rational choice calculation. Generally, both communities have pretty healthy employment ratios, but Floyd's higher ratio may reflect their higher educational attainment. Census data show that educational attainment is positively related to likelihood of employment. Increasing educational attainment could boost both employment and earnings throughout the region. Now for a brief look at some more key findings from the survey. People like living here, and they generally feel good about the schools and local amenities. People are excited about the thriving downtowns, and they believe this is a beautiful place to live. Most say they want more connection, more engagement, more community. Our greatest opportunities to realize our potential as a region appear to be in educating and training a high-quality labor force. This will help us build and attract living wage jobs that can make a difference in our efforts to increase access to affordable, high-quality early care and education, mental health services, affordable housing, and art and cultural experiences. Improvements to infrastructure, including transportation, can provide additional leverage in increasing access to education, employment, services, and quality of place amenities. Before I get to our recommendations, I want to take a closer look at some of what we heard from you. Specifically, I will cover the questions we asked only you and nonprofit executives to answer about priorities for discretionary grant making and priorities for quality of place grant making, a current focus for the foundation. I just want to make a quick note here. I'm highlighting differences as a point of information. I'm not evaluating any of the perspectives represented, simply trying to look at how people who occupy different roles and positions in the community see our needs and priorities differently. As I said at the beginning, these are places where we can learn and try to sort of triangulate perspectives to better understand our challenges. This is hard to read, I know. I'm going to explain to you what the takeaway is here. We asked fund holders, donors, and nonprofit executives to choose 5 top priorities for discretionary grant making. To be clear, there was not resounding consensus. So the greatest percentage was 53.6% of fund holders chose community development. And for nonprofit executives, housing and homelessness took the top spot with 50% prioritizing housing and homelessness. I present both of these sets of responses here because I think it's worth noting that fund holders and donors have pretty different ideas from nonprofit executives in several areas. So I just want to point out a few places where those differences are pretty big. This one is community development here, where 53.6% of funders, fund holders and donors chose that, but only 29.6% of nonprofit executives. Homelessness, housing and homelessness, only 41.1% of donors and fund holders, but 50% of nonprofit executives. Moving down more, arts and culture, which I don't talk much about in this presentation, but is definitely covered in the report. 37.5% of donors and fund holders selected that as a priority, compared to 25.9% of nonprofit executives. And then down here, you see some big differences where food insecurity, 1/3 of our nonprofit executives chose food insecurity compared to only 12.5% of donors and fund holders. 27.8% of nonprofit executives chose substance abuse treatment compared to 12.5% of donors and fund holders. And 27.8% of nonprofit executives chose human services. Well, a lot of them work in human services, so that's sort of understandable, right? Compared to 10.7% of donors and fund holders.
Oh.
Don't worry about the fact that you can't read this. I'm going to move on to one that just shows the top 5. But I wanted to say something about just the distribution of these items. There's not a lot of consensus. This is fund holders and donors' responses when asked to choose top 5 quality of place priorities. And the largest percentage was 40.7% choosing affordable transportation to outdoor recreation facilities. The point of this graph is simply to say there was no more than 40% consensus on a single item. 30.2% of you selected creating safe access on foot or by bicycle to parks and recreation facilities, while 62.4% of the full sample selected this as a priority elsewhere on the survey. Now, this may also reflect your sense of which items are specifically part of the foundation's role. So I don't want to overstate this as any sort of an issue, I just want to point to it. 20.8% of fund holders and donors identified accessibility of playgrounds to differently abled persons as a priority for CFSI funding, while this was the #2 priority for lower income respondents, with 42.1% selecting it. Again, I'm comparing your responses to a similar question, but specifically in reference to CFSI. Your question was specifically in reference to CFSI grant making, as opposed to responses to a question about priorities overall. So they're not entirely comparable. I'm just trying to draw some relationships here. Still, it may mean that it's worth thinking about what the foundation's role might be in creating safe pathways to parks and ensuring they are accessible to those with disabilities. Fund holders and donors' top 5 quality of place priorities include, as I said before, affordable transportation to outdoor recreation facilities, complete streets, so that's sort of widening the streets to make it safer for pedestrians, but it also tends to beautify the streets. Programs to activate underutilized parks, marketing and communications to promote activities and programs in public spaces, programs in existing public spaces, and support for development of outdoor recreational tourism, and creating safe access on foot or bicycle to parks and recreation facilities. And those were between 30 and 40% of fund holders and donors' top priorities. Here, marketing and communication to promote activities is tied with complete streets at the top of the list. So this is of those who selected community development as a top priority for discretionary grants. These were their top priorities. So here you see a little bit more consensus. Those who are interested in community development really see the complete streets and marketing to promote activities and programs in public spaces as key priorities. People in this region have lots of big ideas and aspirations for building vibrant small towns and local communities and a thriving region. They enjoy consensus in their focus on foundational concerns related to infrastructure, education, health, and housing, and at the same time seem to share a vision for new and innovative ways to develop the region around its assets. I encourage you as donors and fund holders to review Appendix C in the full report and consider which big ideas you might want to get behind. Alternatively, you can think about, whether you want to contribute to the larger sort of pots of discretionary funds that can support systems change. The Community Foundation supports system change by focusing on leverage points in strategic areas for a few years at a time to try to move the needle in multiple areas at once, like they're doing right now with quality of place. The idea is to make big grants in an area like, in this case, quality of place, that are designed to try to move the needle in a few of these areas at once. And in particular, you might think about quality of place amenities as an investment also in increasing physical activity and improving health, mental health, and wellness. So that's one example of the Community Foundation doing that. In a few years, they may shift to another focus in a different leverage point in the system. People in this region have sorry, I'm not sure what happened here. The report includes specific recommendations in each section. Because I can't cover all of them today, I'm choosing not to suggest that I think some are far more important than others. And there are topics I didn't even touch on today that are covered in the report. The recommendations indicate that addressing our community's challenges and realizing our aspirations will require engagement from local, state, and federal government, for-profit businesses, philanthropy, and the nonprofit sector. They all have contributions to make to support progress in the region. I encourage the community to go where the energy is, to fund existing programs that work and innovative new proposals, as well as people ready to do the work. That's where we will succeed. And more broadly, based on all of our data sources, I believe that health, education, housing, and infrastructure remain key leverage points to affect changes throughout the community. We also need to pay careful attention to strategies for ensuring living wages across sectors and skill levels, and we need to pay attention to issues of equity. Our findings suggest that the community would benefit from improvements in gender and racial equity, from institutionalizing systems and structures to support single parents, which was a finding I didn't spend time on, but came out in the survey, and from sustainably developing our rural assets to generate more social and economic activity in our small towns. So that's where our recommendations lie very broadly. If you want more specific information by topic area, each section of the report has priorities for progress recommendations at the end, and those are reflected in the executive summary that you may have picked up on your way in. Are there questions or comments or queries? Yeah, great.
Melissa, I was curious to see the information with regard to incomes between Clark and Floyd. Was there any analysis made as how River Ridge has touched upon that particular?
So it's very hard in the data that we're able to have on our region, because we are relatively small population counties, we rely on 5-year data, which means they take a sample of data every year, and each year from the Census Bureau, what we get is 5 years of combined samples, and estimates are made based on that, okay? If we were in Louisville, where they have a really big population, you can get annual data that's more precise. What that means is something like River Ridge, which is a change in the environment, its impact gets dulled when you're averaging over 5 years. So our understanding of the impact of River Ridge won't be visible in census data until it's been around for, until we've seen businesses moving in there for 10 years. Then we'll be able to look at data from before River Ridge to data after River Ridge and kind of see more about what its impact is. I do, however, think that the completion of the East End Bridge is driving some population growth in Clark County that's shifting some of the dynamics that we've watched there, since I moved here and started working on these counties 10 years ago. We're definitely seeing some real shifts in population there.
Okay.
Yes, Linda.
Melissa, you had one slide that showed the differences between nonprofit executives and the fund holders' responses.
Yes.
Down at the end of that slide, the bottom, there was a big discrepancy. The food insecurity, substance abuse treatment, human services. Is that representative, do you think? Some of our surveys, some of the data was collected pre-COVID and some was post-COVID.
Oh, good point, yeah.
And would that be maybe driven by what the nonprofit executives are seeing as a result of COVID?
We can look for sure. We didn't have that many surveys that were pre-COVID because we had just started collecting data when COVID hit. What we've tried to do is build in an indicator that will allow us to look at, at May, when people had a better sense of what COVID was doing, do we see a difference in responses? So I will take a look specifically at that analysis for this set of variables.
That's just such a big difference.
Yeah.
It just makes me wonder.
Yeah, it is a big difference. And those acute needs really became quite apparent at the beginning of the pandemic. And fund holders and donors are an audience that may have been likely to respond to the survey as soon as it hit their inbox. So you may be right. It may be capturing that. So I will take a close look at that. Absolutely. Good point. And we do have the date. So one of the things with the electronic survey is it records the date on which somebody completed the survey. So we do have the capacity to look at it. Even though it has no identifying information, it does tell us the date that they completed it.
A list of these social issues of greatest concern. I've been to several meetings, luncheons, whatever, and heard law enforcement or people from the prosecutor's office talk about the drug problem.
Yes.
And I see that that's mentioned 3 out of the first 6.
Yes.
I don't know what we can do about that. I guess more education.
So substance abuse is certainly driving a lot of other concerns in the community too, right? So it's really interconnected with other things, but clearly is a top priority. It is 3 of the top 6 social issues of concern when people are asked to identify their top issues of concern. And I think that our approach to that is, it has to be multifaceted, but one key piece that several of our local organizations are working a lot on is over the last 23 years, there's been a significant body of research on the impact of adverse childhood experiences on adult outcomes. And some of the adult outcomes that we struggle the most with in our region have been shown in the literature to be tied to adverse childhood experiences. So, across the nonprofit sector and our schools, organizations are shifting to what we call a trauma-informed approach that is intended to help mitigate the impacts of adverse childhood experiences, but organizations are also working on prevention and as I said, mitigation. The adverse childhood experiences are very closely tied to risk for substance use disorders. So if we want to talk about prevention, we have to talk about improving childhood, making it safer, and making sure that kids who are in situations where maybe they have experienced trauma, that they're having opportunities to connect with caring adults, and that they're getting access to resources to help them build resilience even in the face of those experiences. So there's a section in the report on childhood that presents just data on indicators of child well-being. We're not doing great there. Okay, I think it's page 72. And it goes through some of those child indicators, and we really have some problems there. So my recommendation in the report that comes out is to really pay attention to adverse childhood experiences, preventing them, responding to them, and mitigating their impacts. I think it's essential to shifting this generational, because it is also generational. Once people have had those experiences, they're more likely to perpetrate also adverse experiences in the next generation. So the feedback loops, and this is what my class right now is working on a project on this, those feedback loops are really generative. I mean, it really does feed itself, this problem does. So, so we need to do something about it.
That's great. There's suicide and alcoholism.
Yep.
You see that repeated.
Yep.
And I'm really glad to hear.
Yep. So there's definitely some information on that in the report. I do encourage people to take a close look at that, because I do think it's really important work that could be an enormous leverage point for our region. Bob.
Has the substance abuse issue been further broken down as to what the substance is?
Not here, not in this report.
The reason I asked the question, as a landlord, I see a lot of tenants that have problems, and most of the problems go back to substance. It's either methamphetamine, oxycontin, heroin, or beer and vodka.
Yes.
I see as many people have a problem with vodka, with beer, as the other drugs combined. Is it differentiate those?
So I will
all into one.
Well, I will say two things. One, right now we are conducting a Floyd County survey on attitudes and behaviors around drug use. I encourage people to take that survey. And so I'm happy to spread the word more on information on that. But that is trying to get at attitudes and behaviors around different substances of use, right? So that we can break down some of that. I will say that in our, we have youth data on that for our area, but the survey we're conducting now would be our only good source of broader self-report data on that for our area. But if you look at things like overdose deaths and hospitalizations, which the Floyd County Echo Group and the Clark County Echo Group are both trying to look at those issues more carefully, we definitely see a pretty high prevalence of alcohol-related illness and death. And far more so than I think people realize. So yes, we have this opioid issue, but we also have a very significant alcohol issue in our community. Methamphetamine is back on the rise. So it has come back into the picture in a pretty big way. When opioid supplies kind of faltered a little bit, meth just came right in to fill that void. When things slowed down with the pandemic, some of the international drug trade slowed down and meth was more homegrown, and you saw it come back in and take center stage. Fentanyl, all kinds of different drugs laced with fentanyl, definitely causing overdose deaths in our community. But as I said the other day to another group, I'm on the overdose fatality review team for Floyd County, and I will say what surprised me about just really looking at some of those records is how many very young people, and it's not like it's some huge number, but any is significant, but very young people in their early 20s are dying of alcohol poisoning resulting from consumption.
The alcohol is more socially acceptable than the drug.
Yeah, And we had on one of these, these are public records. In one case, the coroner's report included from, information from the family suggesting that this individual was drinking as much as a gallon of vodka a day. Yeah. Obviously, the human body can't handle that. I mean, that's no surprise that led to a death.
How old
Right?
was the person in the 20s?
24. So we have a real issue and we need to be really honest and upfront about it. And I think we've had a tendency, because it's culturally acceptable to use alcohol, we have a tendency to not deal with it in a way that's true to its real impacts. So the Floyd County Echo Group's working on that. Floyd County, like I said, and Clark County Echo, and other prevention groups, the alcohol, tobacco, and other drugs, the communities that care. We have a number of different coalitions that work on substance abuse prevention and treatment. And they've been trying on these issues, but we need the broader public to recognize the problem. Other questions?
No, all right, well, thank you. We're so fortunate to have Dr. Fry in our community, on our board, and doing things like this for us. So thank you very much, Melissa.